My name's Ruth Eakin. I've been a consultant in the Belfast Trust for 20 years, and at that point my elderly father, who lived on his own across town, like everybody, needed somebody to come to their flat every day and look after things. 18 months after we started doing that, there was a clear issue with memory, and we went to the memory clinic, and he received the diagnosis of Alzheimer's in January 22. When we got the diagnosis, he moved into sheltered supported living then a few months later. So he's been in another nursing home now for a couple of years or so, and has just had his 92nd birthday. And I still go to him every day. He still enjoys going out in the car, and he still knows me when I arrive, and I feel very much that I still want to be there and support the people who are caring for him full time. I changed my work. I realised after a number of months that I couldn't keep doing that. I wasn't giving anybody what I should be giving them. And 1 in 8 people are carers, so 1 in 8 of the 22,000 staff in the Belfast Trust will be carers as well. So I discussed it with my manager in the Belfast Trust. So I was able to reduce my working time considerably, and then that helped me also to get involved in the carer feedback, particularly after he'd been in hospital. So after the diagnosis, one of the paths led me to the carer support service. And that was amazing. The carer support service explained to me that I was a carer, at which point I was, really, am I? And that's when I began to understand what a carer actually is, a family unpaid carer actually is. It's not someone who goes into somebody's house 4 times a day. That's a paid care worker. It's so important that people like myself in a professional role understand that entity, to strive for what we all strive for as professionals, which is the very best care for our patients. The first and most important thing to me was to actually understand that it is a recognised role. And I think sort of what went through my head when they said that after a little while was, my goodness, somebody else actually appreciates what I am doing here other than myself and my dad. You know, that meant a huge amount to me, to actually have somebody else say that that was a role that was being appreciated. People just do it, that's the thing, and that's not recognised by a lot of people. It's not recognised by a lot of professionals. And I just feel really strongly that it needs to be recognised, it needs to be understood, it needs to be broken down. Carers and I talk a lot about identifying carers, and so does the Department of Health. We need to identify carers. Well, you know, I've always said, well, all carers are attached to a patient, and all patients come across HSC staff. So if all HSC staff genuinely understand who a carer is and the role of that carer, you've got an easy way of identifying carers. I went through a bit of a difficult phase when my dad was admitted to hospital. He was quite distressed, and I was sort of told, what visitor slot do you want, 2 to 4 or 6 to 8? And I'm like, well, I'm not here to have tea and buns and talk about the weather. So that's what visitors do. I wasn't coming to tell him what was happening outside. I was coming to help him communicate, help him settle. He was really quite distressed at times, and I just wanted to be there and reassure him. And that's very different. Primarily, it's about supporting that patient, that person alongside our patient, to improve the care of our patient even more. And if it's done well, people never forget you. If it's done badly, they never forgive you. So, you know, it's just really, really important aspect of patient care. We need to understand who carers are, first of all, and then we need to have the skills to discuss that with patients, with their carers. And it is a culture shift. We're very, as professionals, we're very rightly so focused on our patients. And I just think there's something missing about how we embrace appropriately the people around our patient, which is our number one. And therefore that in itself helps to support the very best patient care, which is what every member of HSC staff wants for every patient. I think becoming involved in the carers network and the care strategy has been really, really helpful. It's like giving something back. I'm really grateful for the care that my dad has received and for the support that I have received as a carer, being identified and then supported. Having everybody together in the one space where possible to bring in new ideas is just really important. And that's really, I suppose, the essence of co-production, is get everybody in, get everybody's ideas in at the start. And there's some incredible ideas out there that nobody in the staff could ever have thought of. We developed a carer's leaflet, being heard and being able to discuss what are the things that maybe could be done better from everybody's point of view, but also understanding everybody's point of view. So some things are possible, some things are not possible. What is the best way that everybody's involved in developing? For me, it was really beneficial, particularly to have the carer support service team to be able to talk to, who did understand things and who are coming from a professional background. They were just amazing. The fact that they actually existed blew me away. And then I began to understand how important family carers and what that role was about. A lot of medics and healthcare professionals just don't really think about themselves. They just get on and do stuff. And that's certainly something that I have learned over the last few years, that you do need to actually look after yourself so that you are the best you can be to look after your loved one. And there's nothing wrong with that. So it was the carer support service really sort of got that message into me. It's about offering as many different ways as possible so that people can then find what works for them. Supporting and educating staff who have not had the experience of being a carer, and also for all staff, even those who have been a carer, support to identify and understand who carers are. And I think if all HSC staff truly understood the entity of the carer, what the impact that carers actually have, and how best to engage in that and how to engage in it safely. In my view, staff training will probably have the biggest impact overall.